Before you begin to learn about the various categories of mental disorders, it is important to keep in mind that many mental health professionals are concerned about the lack of reliability and validity of some diagnoses. A historical view of the evolution of psychiatric diagnosis shows many instances where what was once considered a mental illness is now recognized as a medical condition. People with epilepsy were once locked away in insane asylums or thought to have been possessed by the devil. Runaway slaves were once diagnosed with drapetomania, a disease that makes them want to escape captivity. What was once a psychiatric diagnosis called general paresis is now known to be caused by late-stage syphilis. We would like to think that each diagnosis represents a discrete disease entity. Different individuals might have a more or less severe case, but everyone with the same set of symptoms would have the same disorder, shouldn't they? Well, when you look at the categories of mental disorders in the DSM, it reads like a menu at a Chinese restaurant. You pick 2 from column A and 2 from column B, and everybody gets egg roll. There are some diagnostic categories in which you could have 2 people with the same diagnosis who share very few common symptoms. Another area of concern in making a psychiatric diagnosis is in regards to treatment. Ideally, as in medicine, the value of making a diagnosis is that it indicates the necessary treatment. If someone is experiencing a psychotic symptom, it's natural to assume that they need antipsychotic medication. However, what if the psychotic symptoms are caused by extreme depression or mania? If the psychotic symptoms lead to a diagnosis of schizophrenia or some other psychotic disorder, the person may not receive treatment for their depression or mania, which use different drugs. Moreover, given that psychotherapy for depression can be as effective or even more effective than medication, it's a real disservice to the patient if this option is not even considered. Perhaps the most insidious problem with diagnosis is one that is inherent in the labeling process. The value in attaching a label to someone's behavior is that it helps us focus on what is important. The problem here is in knowing what is important and what is extraneous. Labels act like filters in that any information that might challenge the validity of the label is easily dismissed. In fact, the filtering process is often so fundamental that it happens unconsciously. We're not even aware that there is information to which we're not paying attention. Labels once attached can be very hard to remove. Labels tend to follow people for a lifetime. They have a way of making us think that we fully understand what is being labeled, when we may only have a partial picture. This can even happen to the person to whom the label is being applied. A person who accepts the validity of a psychiatric diagnosis may come to feel that there is nothing he or she can do to overcome their problems because of the permanence of this condition. Eventually, it becomes a kind of crutch that holds back whatever progress he or she may have made. It becomes the most salient aspect of their sense of self. He is a depressive rather than a person who has depression. She becomes an anorexic rather than someone who has anorexia. Once again, getting the diagnosis right is important in helping someone minimize their suffering, but it can also have several negative unintended consequences. As you proceed through the material in this course, I hope that you will keep an open mind about the value and the potential problems with defining someone's behavior as abnormal.